Are the little memory slips you notice in a loved one just aging, or something more? Today we cover 5 early signs of dementia after 65 that families commonly miss, why they're important, and exactly what to do next.
This is careful, practical guidance, not medical advice. If anything here sounds familiar, please schedule a medical check. Early evaluation can make a huge difference.
Quick overview. Dementia is an umbrella term for conditions that affect memory, thinking, behavior, and daily function. Alzheimer's is the most common cause, but there are others: vascular dementia, Lewy body, frontotemporal, and more. Early detection helps rule out reversible causes, manage symptoms, plan for safety, and connect families with resources.
We're splitting this into 5 clear signs. For each one, we'll explain what it looks like, how to tell if it's serious, and practical next steps for families. Write down examples. Doctors want concrete incidents, not general worry.
Sign 1. Persistent short-term memory loss that affects daily life. This goes beyond forgetting where you put your glasses. It's repeating the same question within a short period, missing recent conversations, or relying constantly on notes for simple daily things. Example: Mrs. Khan asks the same question 3 times during brunch and can't remember agreeing to a doctor's appointment she made yesterday. That pattern, repetition within days with increasing frequency, is what's concerning. Why it matters: early dementia typically affects episodic memory, recent events, conversations, appointments, before long-term memories. Memory slips that interfere with work, finances, or safety are red flags.
What to do? Keep a short log for 2 to 4 weeks. Note date, time, and a sentence. What happened, and whether they later remembered. Bring this list to the primary care appointment. If memory loss is sudden or rapid, seek urgent care. Some causes are reversible, like infection, medication reactions, or metabolic problems.
Sign 2. Difficulty doing familiar tasks or following steps. This could be trouble with cooking a recipe they've used for years, losing track when balancing a checkbook, or confusion with everyday devices like the TV remote or microwave.
Ask them to demonstrate a familiar routine once, maybe making a cup of tea or paying a bill online. If they can still do it reliably, that's reassuring. If they repeatedly get lost in the sequence, that's a sign to note.
Rule out physical causes. Arthritis, poor eyesight, or hearing loss can mimic confusion. Also consider depression or fatigue, but cognitive decline will appear as consistent trouble with multi-step tasks despite intact physical ability.
Immediate steps. Simplify tasks and add temporary supervision for safety. For example, set items in order, label cupboards, and avoid leaving hot appliances unattended. Share specific examples with the doctor.
Sign 3. Changes in language. Word-finding trouble, repeating words, or losing the thread of conversation. They may substitute unusual words, pause frequently, or write sentences that don't make sense.
Family example. Mr. Lee used to be fluent and witty, but now he hesitates, calling a watch a hand clock, or he leaves stories half-finished. Conversation becomes frustrating for both of you.
Why this matters? Language problems, aphasia, are often early in some dementia types. If language decline appears with memory or planning problems, it strengthens the case for a cognitive evaluation.
Practical advice: don't finish their sentences or correct them loudly. Gently prompt with options. Record a few short examples, with consent, to show the clinician date, what word they couldn't find, and how often it happens.
Sign 4. Disorientation, getting lost in familiar places, poor judgment, or sudden unsafe decisions. This may include wandering, leaving the stove on, falling victim to scams, or strange financial choices.
Safety example. A neighbour who always walked the same route now takes wrong turns and can't find their way home. Or someone who suddenly sends large sums to an online friend. These are urgent safety signals.
Why it matters. Disorientation and impaired judgment increase immediate risk. They can indicate problems with spatial awareness, executive function, or both. This dramatically raises the need for assessment and safety planning.
Immediate actions. Evaluate driving immediately. Temporarily remove keys if risk is present and arrange transport alternatives. Limit unsupervised access to finances. Add visible safety measures, stove timers, smart plugs, and regular check-ins. Then get a full medical evaluation.
Sign 5. Mood and personality changes or social withdrawal. Depression, apathy, loss of interest in hobbies, increased irritability, suspiciousness, or emotional flatness can all be early signs.
Important note: don't assume low mood is normal aging. Many treatable conditions, depression, sleep apnea, medication side effects, mimic or worsen dementia. But new or worsening personality changes, especially combined with cognitive signs, should trigger evaluation.
Care tip: if a previously social, cheerful person withdraws from family gatherings or becomes unusually paranoid, document when it started, how it's changed, and whether any life stressors align with it.
What doctors will do: expect the clinician to take a detailed history, review current medications, look for reversible causes, vitamin deficiencies, thyroid problems, infection, medication effects, perform a cognitive screening test, and order basic blood tests. They may refer to neurology, geriatrics, or a memory clinic, and sometimes brain imaging is suggested.
Tests you may see: Mini Mental State Exam, MMSE, or Montreal Cognitive Assessment, MOCA, for screening. Labs often include CBC, metabolic panel, thyroid stimulating hormone, B12 level, and sometimes vitamin D. Imaging, CT or MRI, is used when cause or pattern is unclear.
How to prepare for the appointment: bring your symptom log, a list of medications including OTC and supplements, recent illnesses, and a family member who can add observations. Be specific. Say Dad got lost on Elm Street 3 times in 2 weeks, rather than he's been off lately.
Safety checklist families should address immediately while evaluation proceeds: driving, cooking, and stove use, medications, are pills taken correctly, access to money or internet, risk of wandering, and fall risk in the home.
Simple safety steps: remove throw rugs, add night lights, keep frequently used items within reach, use a pillbox with alarm, and install door alarms if wandering is a concern. Consider a GPS device for high-risk people, only after discussing dignity and consent.
Treatment support. Some dementias have FDA-approved medications that may slow symptom progression or improve cognition temporarily. Symptoms like sleep problems, depression, anxiety, or agitation are often treatable and improve quality of life.
Treatment also includes non-drug approaches, structured routines, cognitive stimulation, physical activity, good sleep hygiene, and managing vascular risk factors, blood pressure, cholesterol, blood sugar, and smoking cessation. For families, early counseling and support groups are invaluable.
Legal and financial planning. Act early. While the person can still participate, set up advance directives, power of attorney for healthcare and finances, and update wills. This preserves autonomy, reduces future conflict, and prevents crisis decisions.
Caregiver advice. Don't try to carry this alone. Seek local Alzheimer's or dementia organizations, social workers, or community geriatric services. Ask about respite care early. Caregiver burnout is common and preventable.
When to seek urgent help: sudden confusion, new weakness on one side of the body, fever, very rapid deterioration, or signs of infection or stroke. These require immediate evaluation.
Emotional support. It's okay to feel overwhelmed, guilty, or angry. Dementia changes relationships and roles. Connect with others who've been through this, and consider counseling, both for the person and for family members.
A real example: a son noticed his mother repeating herself and misplacing items. He created a short log for 3 weeks with dates and incidents and took it to their PCP. Labs found low B12 and hypothyroidism, both treated, and a memory clinic performed tests showing early Alzheimer's. Because they acted early, medication and lifestyle changes were started, and they set up a care plan and legal documents while Mom could still participate. This is why documentation matters. Concrete examples help doctors differentiate normal aging, reversible causes, and progressive dementia. Quick recap. Watch for 1. Persistent short-term memory loss that affects daily life. 2. Trouble performing familiar tasks. 3. Language and communication problems. 4. Disorientation, poor judgment, or unsafe decisions. And 5. Mood or personality changes and social withdrawal. If you recognize any of these signs, please schedule a medical evaluation. Bring a family member, create a simple incident log, gather a medication list, and be ready to discuss recent changes. Final practical checklist, if you're worried. 1. Start a 2-week log with dates and short notes. 2. Gather all medications and paperwork. 3. Book a primary care appointment and ask for a cognitive screen. 4. Remove immediate hazards at home. 5. Talk with another family member and share your concerns so you're not alone. We want you to be empowered, not scared. Early action gives you options, treatment, planning, and support. It preserves dignity and keeps your loved ones safer. This information is educational and cannot replace personalized medical advice. If signs are severe or rapidly progressing, seek urgent medical attention. If this helped you, leave one short example in the comments, such as, "I noticed repeated questions," so others reading the thread know they're not alone. And if you want a printable one-page checklist for doctor visits and safety, type checklist below and we'll post.
Thank you for watching. Take care of yourself and each other. Female VO. See you in the next video. Goodbye for now.